Good afternoon. I'm Sandhya, and I too I'm from the same institution where Dr. Bindu came from. And today this is the topic I'm presenting on. It is profiling cognitive deficits in brain tumors using ADDENBROOKE'S cognitive examination as a screen. Well, many of you may not be knowing what ADDENBROOKE'S cognitive examination is. I'll be coming to that in a minute. This is the introduction. Tumors of the brain could be largely classified into intraaxial and extraaxial. Intraaxial is those growths, those lesions that happens inside the brain. And extraaxial happens outside the brain. It's skull-based. So, irrespective of whether they are intraaxial or extraaxial, these lesions results in the deficits of cognitive functions and brings about changes in linguistic and behavioral functions. So, how do these lesions create these kind of problems? It is like this. Through compression, through displacement of brain, destruction of intracranial structures, and associated cerebral edema. Now, it's not just the lesions alone that brings about these cognitive changes. Those things that are supposed to help the patient, that is the treatment itself, brings about cognitive deficits. Be the treatment, the surgery, radiation, chemotherapy, or adjunctive medications such as corticosteroids and anticonvulsants, it all results in adverse functioning of cognition. Now, why is cognition so important? Why are we talking about cognition here? It is because it is an index of recovery as well as relapse. As the cognition improves, it tells you the patient is improving or the tumor is kind of going into remission or the resection was successful. And in the case of a relapse, again, the cognitive functions goes down. It starts to diminish. It points towards illness progression in those tumors which are like fast growing, where surgery can only do so much or where any therapy can do only so much. Time to time, assessing the cognitive functions will tell you how much of progression is happening. And it also has implications for decision making and informed consent, and implications for prognosis. Now, what is ADDENBROOKE'S cognitive examination? It is considered to be a sensitive test of cognitive dysfunction, and it reveals a lot of cognitive impairments in tumor. So cognitive examination is a quick cognitive test that leaves pointers on a variety of cognitive functions. Can be used as a bedside test as well. And I don't know whether lot of you may not be familiar with MMSE. MMSE is mini mental status examination, as I was talking to one of the friends I made yesterday. Yeah. It actually gives it helps you to assess quickly the cognition or the cognitive status of the patient. So, but the problem with MMSE is that it has got ceiling effect. Ceiling effect, once again, I don't know how many of you would be knowing what it is. Suppose a test is done. The test is so easy, and all of you score 10 on 10. It has got very high ceiling effect. Okay, the test is ridiculously simple. The same applies here with MMSE. So ADDENBROOKE'S cognitive examination has this advantage that it looks at even more cognitive aspects, and it is not as simple or easy as MMSE is. And studies have shown, as you can see from the reference, promising diagnostic performance, and it is proved that it could be administered at primary care level, which can extract significant performance or non-performance indicators. Now, the aim of the study was to check whether ACE can be used. ACE is the short form for Addenbrookes Cognitive Examination, whether ACE can be used as a cognitive screening tool, and also wanted to find out the sensitivity and specificity of the tool. That's a design sample inclusion-exclusion criteria. The design was a prospective cross-sectional design. 74 patients diagnosed to have tumors. Tumor was taken into the study and prior to any surgical interventions, and all of them were drug naive. Patients selected were 18 years of age and above. Only literate patients with no sensory impairment were included in the study, and any patient with sensory impairment and gross cognitive deficits, and who are on anticonvulsants, corticosteroids, and those who have aphasias were excluded. That was statistical analysis I did. Well, that's it. Now, patients with high-grade intraaxial tumors, when I talk of high-grade tumors are WHO graded 3 and 4, which is rapidly growing, has got poor prognosis. So patients with high-grade intraaxial tumors showed a significant association on the cognitive domains of registration, recall, and visuospatial functioning. Recall is nothing but memory, and registration is I say something, how much do you register so that you can recall it later. That is registration. And visuospatial functioning. Visuospatial functioning, for those who are not really familiar with the term, it's the ability that helps you to find you in your space, that helps you to navigate you in the space. So all these domains were found to be a significant association was found on all these domains. And also a significant association was found between tumor grade and Addenbrookes score, as well as with the MMSE score. And here also, high-grade tumors showed more cognitive deficits as were expected. Now, all those in black, that is like emboldened, are the data which I was just talking about. However, association of gradable extraaxial tumors, that is tumors that grow outside the brain, that is skull-based, could not be analyzed because of there wasn't that too much of data of high-grade tumors. So that is kind of left incomplete. And no significance was found on the laterality. Laterality is on which side of is it on the left side or on the right side the tumor is situated. No association was found here also, perhaps due to the sample size was not adequate enough. And only on one dimension, that was on memory, an association could be obtained. There it shows. And a receiver operating characteristic curve was used to estimate the sensitivity and specificity of ACE. Malayalam. That is, Malayalam is the language that is spoken from the part I come from, and it has been, the tool has been translated and validated in Malayalam. So that is the sensitivity and specificity. And that is the ROC curve, where the estimation of 0.75 area indicates fairly good discriminative ability, so that ACE can discriminate between different cognitive domains. And a cutoff of 71 by 100 was computed with sensitivity at 77.3 and specificity fixed at 67, which all statistically indicate that it is high. Now, what are the limitations of this current study? A bigger sample, of course, and I didn't have enough of data on extraaxial tumors, so that I couldn't bring out more of results on extraaxial high-grade tumors. And the conclusion is, ACE Malayalam is capable of bringing out cognitive deficits and can be used as a quick screen. So in busy clinics or in busy settings, hospital settings, I'm telling again, ACE is not a substitute for a full-fledged cognitive battery. This is only an aid, and it is a very useful aid. It can be used as a quick screen or a quick measure of cognitive functions, leaving a lot of pointers as to what are the areas where problem lies. And the tool also shows fairly good levels of sensitivity and specificity. Thank you. Questions? Any questions? Thank you.